this is Dr. Leonard with Central Ohio Spine and Joint here in Columbus, Ohio. What I wanted to do this morning, I'm kind of here by myself, so you're going to have to bear with me on this video. I wanted to show you a couple things that I actually do for myself when I'm dealing with a little bit of back pain. Earlier in the week was working out, felt a little twinge, so things have been a little bit tweaky within the back. When I get back pain, it's mostly localized. What happens is it almost feels like it grabs at times, and typically what that means is we're dealing with a little bit of spasm in the back and a little bit of poor coordination in how the spine is moving. So I wanted to show you a couple moves that I usually do for myself. I'm about to start with patients here, so I was going to go through a couple mobilizations and just wanted to hop on a video and show you how I do it. So the first thing I do is I use this kind of medium band here. This really helps when you're by yourself. I'll show you in another video how you can do this with someone. We do mobilizations like this in the office with patients where I'm actually doing the mobilization. For now, we're going to have to actually use the band. So the first thing I do is we're going to put this band behind the back, and I'll kind of walk up here. I'm going to put this band right on the level where I'm actually having some discomfort, which is right around kind of that L4, L5 area. We're going to come up to a table. You can do this on the floor, and we're going to go to all fours, keeping that band right on that L4, L5 area. The first thing that I'm going to do, we talk a lot about creating intra-abdominal pressure with your breathing. This is a really good way to get some feedback. When I breathe in and expand down through my torso, what I'm feeling is actually some expansion into the band itself. So when I breathe in, I expand actually into my back, and you'll see the band actually move just a little bit. So breathe in and breathe out. The second thing that I like to use this is a little bit of mobilization. So we're going to go into kind of a modified cat-camel. You've probably seen this before in yoga where you do a little bit of mobilization for the T-spine. We're actually going to focus a little bit more now down lower. So what I do is sit back just a little bit, and all I'm going to do is I'm going to try to push the band back and then bring my hips forward and let the band pull on that area. Bring it back and let the band pull forward. So this is doing two things. Number one, it's actually giving me a little bit of mobilization in the area. And the second thing is I'm working on a little bit of segmental control. I'm able to kind of move through that segment, which, like I told you before, when I deal with a little bit of that grabbing or catching, it's because I've lost the ability to segmentally move through that area or a little bit of poor coordination. So try this out, use this band. You can use a rope, you can use a stretching strap. It doesn't have to be flexible, but it'll allow you to get a little bit of feedback of first breathing into the back and then utilizing it for a little bit of mobilization. If you have any questions, feel free to ask away in the comments. Make sure to share this on your pages so other people can see it. Hope you have a great day.